Hi, Hi everyone. Thank you for joining us today for our live on Foot Health Q&A, Athletic Lifestyles. My name is Tatiana, and we're here with Dr. George Ampat. Hi,
Hello,
Dr.
Tatiana. Thank you for inviting me and allowing me to join.
Of course, we're so happy to have you here. So for those who are new and those who are returning every Friday to help to watch us and support us, thank you for joining. And today's topic is about athletic lifestyles. So for the month of April, because April is National Foot Health Awareness Month, every Friday we are talking about a different type of foot ailment or topic and just talking about it with Dr. George. We're going over what the ailment is, who experiences it, how it feels, and what are some great Aetrex products that can help relieve that pain. So in the past, our first live was on plantar fasciitis, then it was metatarsalgia, bunions, and today is athletic lifestyles. And today is also Earth Day. So we think it's a great time to talk about athletic lifestyles and being outside, taking care of your body, enjoying the beautiful earth. So, Dr. George, can you tell everyone at home a little bit about yourself and about your research with Aetrex?
Thank you, Tatiana. I'm George Ampat. I'm an orthopedic surgeon. I'm originally from India, South India, Kerala, and Malayalam is my mother tongue. After doing my medical schooling in India, I moved over to UK for some higher training. And though I came just for a few years of training, I've stayed there. I've been there for the last 30 years. And I'm a consultant orthopedic surgeon. My special interests are spine and foot and ankle problems. Now, though I have been a surgeon cutting open people, I developed an interest in trying to help people without surgical intervention. Surgery is good, and I have nothing against surgery, but actually, we should not do surgery when it is not needed. And also, important, we need to try to maximize the non operative methods of helping people. Because unfortunately, surgery is an irreversible step. You buy a house, you don't like it, you can sell it off in the market at a reduced price. But once you have surgery, you can't sell that surgery off on eBay. You're stuck with that. So it is an irreversible step, and hence we need to be clear in our minds that surgery is absolutely essential before we place a knife on a patient. Same way for the patient. So, in that quest, I wanted to find out what could help patients, especially with foot problems. And I came across Aetrex. And then, the more I started prescribing Aetrex, I found that this was a very good orthotic, easily available, quick rather than wait for a customized orthotic. And it seemed to be better than, and actually better than customized orthotics in my practice. So that is why I fell in love with Aetrex orthotics, and the that interaction slowly progressed. And now I'm part of as a medical consultant for Aetrex, and I'm doing three research projects for Aetrex. The first is orthotics and running. Running, as you very rightly said, is becoming very popular because people want to go out, run, keep themselves healthy. But unfortunately, as we run, there are injuries that are being faced. Now, injuries are painful for the patient and also costly to him or her, and also to society. So we are trying to see methods how we can decrease that injury rate, and orthotics may be able to help. The second is orthotics and plantar fasciitis. Plantar fasciitis is where we have pain in the heel, and many people suffer from it. So what can we do? We can have injections, operations, but they are all interventional. Is there ways by which without intervention we can help them? There are problems with injections and operations, and that is why orthotics is a non-interventional step, easily done, and gives you the relief that you desire, or having some flips also in addition to the orthotic. The third research is on the orthotics and seniors. Seniors, as they become older, they have pain in their feet, and when they have pain in their feet, they don't walk, and when they don't walk, their cardiovascular fitness decreases and increases their exposure to heart attacks and strokes. So just by giving orthotics decreases the pain in their feet and makes them walk more. And we feel that will actually improve their activity levels and also improve their general physical health. So those are the three things that we are currently doing the research on. Thank you, Tatiana.
Thank you, Dr. George. So yeah, everyone at home, Dr. George is working with Aetrex on these research projects, and one of the ones he mentioned was about running and plantar fasciitis and how it's related. And running is a very, very important healthy activity you can do. It's free. You can just go outside, you can run, you can go for a walk. And a lot of people who lead athletic lifestyles, they may face some certain foot ailments, So, Dr. George, can you explain some ailments, either to the foot or the knee that some people with athletic lifestyles may be experiencing or can experience?
So I would today in our talk we would discuss about one is plantar fasciitis. Number two, we will talk about knee patella syndrome. Three, we will talk about metatarsalgia. Four, we will talk about medial tibial stress syndrome or shin splints. And lastly, we'll also talk a little bit about stress fractures. I hope I'm not diluting by giving different topics and only
Oh, it's
giving a
very
little bit.
helpful.
Thank you, thank you. So let's look at that. But before we look at that, we need to understand why we may be getting these problems. Foot problems of increase. Now, one of the reasons they say is because of the surface on which we walk. Now, if you take any movable object, whether it be a car, whether it be a battle tank, it has a particular surface on which it can go. So a car is well suited for maybe a tarmac road, but a battle tank is better for rugged ground. If you take a battle tank and put it on a road, it is not going to move well and there's going to be damage to the road. Same way, where is our foot more positioned, ideal to walk on? We were apes, and from apes we evolved and descended to the ground. But when we descended to the ground, we were supposed to walk on soft ground, on grass or on sand. But unfortunately, when we invented the wheel, we decided the wheel goes better on all hard surfaces, and we made all habitable surfaces very hard. And that is why there is a mismatch. That is not the ideal surface on which our feet should be resting and walking. Our feet should be walking on sand or grass or some soft surface. Let me give you an example, and this is very easy for you to understand, even in your homes. Imagine you're walking, on a good, lovely morning, spring morning, you're walking on on a sandy beach. As you walk, you're creating an impression in the sand. Next, imagine you're walking on a hard, rocky surface. Which is the surface you want? If you had the ability to carve out that surface and take it with you, which surface is it? The hard, rocky surface or the smooth, contoured, sand that you would want to take home to have or to enjoy perpetually? It is that sand where there is a contoured surface, and because of the contour, there is no increased pressure as the pressure is evenly distributed over a wider area. And that is exactly what Aetrex Orthotics does. It is not a hard orthotic, it is a soft, not a very soft orthotic, but a firm orthotic, the same consistency as what you would expect in sand or on grass. That was the surface that we had to walk on. But unfortunately, many of these ailments occur because of overpronation. Any majority of the sports involve moving about quickly, either running or jumping. And when you run and jump, there is overpronation. And this is what I can show you by overpronation. If you see the image on the top, you can see on the inside, the whole of the ankle rolls inward. And that is because it touches the heel and the ball of the foot, and there is a tendency for the whole foot arch to roll in. And that is what is happening in the diagram above. But as soon as you put an orthotic with a little bit of a heel wedge, which when I mean a wedge, the inner surface of the heel is slightly at a height rather than the outer surface. By doing that, we are correcting the entire ankle and the foot, and there is no more overpronation, and we are able to walk steadily. So not just that it corrects overpronation, but also gives an increased surface area and as we will explain today, an increased surface area helps us with moving about very quickly. And that this overpronation is as you run. When you land, we are landing on our heels. When you land on your heels and the body weight goes inside to every foot, whether it's your right or your left foot, as you run, you're landing on your heel. Now, there's a difference in the type of running when we do short running and when you run barefoot. When you run short running, that's what's seen on the left. You're landing heavily on your rear foot or on the heel. But when you land so heavily on your rear foot, that impact or that kinetic velocity is passed through the ankle, the leg, the knee, and the hip. And in this domino chain. Any part of the body is affected because of the repetitive injury. But on the other hand, when you run barefoot, you're landing on your forefoot and the muscles are very taut, and hence there is no increased stress to the rest of the body. But unfortunately, the world is so bizarre. We have so many loose particles, we cannot run barefoot. So if you have to run with the shoes, how can we run with the shoes and prevent injury? And that is what we are looking at. By using an orthotic inside the shoe, we can decrease those injuries. Now, a couple of the injuries that we would like to look at is plantar fasciitis. Now, so plantar fasciitis is when the heel, so there is a ligament that attaches, which recreates or which makes the bow or the arch of the foot. Unfortunately, where it's shown as red, that particular ligament gets stressed by a repetitive injury and it can become very painful. People who have plantar fasciitis have severe pain first thing in the morning when they get up, and when they put the feet on the floor, it feels as if they are on hot coals or on a sharp pointing knife. Now, to reduce the incidence or to reduce or the effects or the pain from plantar fasciitis, all one needs to do is to wear an arch support which cradles the foot. By cradling the foot, you are preventing that repetitive injuries every time you land on your heel and the bow is being stretched. You decrease that repetitive injury and there is relief from plantar fasciitis. Another injury that can occur is metatarsalgia. Metatarsalgia is pain in the ball of the foot. And I am sure Brittany will show us that image now. So this is mainly because the first great toe is not as long as the second, third, and fourth. And you can see in this image where there is a red impression, I shaded it red. Those are the second, third, and fourth metatarsals. The second metatarsal is slightly longer than the first metatarsal. The first metatarsal is a continuation of the great toe. Ideally, the first metatarsal should be the longest, and it is the stoutest and can withstand the rugged repetitive injury. But unfortunately, when the second metatarsal becomes longer, it is not able to take weight, and there may be pain in the heads of the second, third, and fourth metatarsal. But to decrease the increased pressure here, all one we need to do is to place a metatarsal pad here so that the pressure is taken by much more proximally or ahead of the metatarsal heads, and pain is not experienced by the person who is doing the repetitive injury or the sporting activity. Then let us talk a little bit about shin splints. Shin splints or medial tibial stress syndrome, if Brittany can, is on the lower part of the leg. It is on the inside of the leg and not on the outside. Sometimes you can get posterior shin splints, but mainly it is anteromedial. There is an edge of the bone, and that is where we get shin splints. And shin splints is a spectrum. On one end is a shin splint, and the next extent is a stress fracture. Now, the next slide is the common stress fractures that could be in the foot, just underneath the ball, where it's a sesamoid, or it could be where I showed you the lower end of the tibia, where there's a medial tibial stress syndrome, and on the metatarsals. Now, what is a stress fracture? Let me give you an example to make you understand. Bone has steel. The steel in the human body is called collagen. It's not normal steel that you use in industrial factory, but the collagen forms the steel inside the body. Now let's assume that this bone here, the tibia, has about 100 steel fibers or 100 collagen fibers. Actually, there are millions of collagen fibers. Now, a fracture is when all the 100 are completely ruptured at one point. So you drop a 50 kilogram or 100 kilogram weight on your leg, the leg breaks completely. That's a normal fracture. But instead of dropping a 50 or 100 kilogram weight, you're repeatedly striking the leg with a 1 kilogram weight or a half a kilogram weight. Now, the half a kilogram does not have the ability to break all the 100 collagen fibers, but it may have the ability to break 2 or 3 collagen fibers. So repeated running will break 2 or 3 collagen fibers, and then the body has this natural healing system whereby it tries to heal. So at any moment in time, there is repeated damage and also a repeat healing, and that is what is known as a stress fracture. So you can have stress fractures in the bottom of your tibia, or on the metatarsal neck, or on the sesamoid bones. Now, another thing that we need to also show, I don't know whether that image is with Brittany, is where there is the pronation in the foot is conveyed upwards, where Not that one. There is a whole leg is shown, Brittany. I'm sorry, maybe I
Yeah, I
confused
don't think
you.
we have that one, but that's okay, Dr. George. If you want to show it,
Yeah, this
here.
is this is yeah, no. Don't worry. Go to the previous one. That's fine. So if on this you will notice that when there is overpronation, the foot turns inwards. When the foot turns inwards, the leg turns inward. And when the leg turns inward, the thigh also turns inward. And actually there's an increased pressure on the kneecap because the muscles that are attached to the kneecap is pulling it outwards. And that is why one of the commonest injuries in running is the knee patellar syndrome, or people complain of pain underneath the kneecap. So the knee is the commonest site of injury, next only coming to the foot, sometimes the hip or the back. Now, stress fractures, as I explained, can also occur in the kneecap, but it's mainly in the lower end of the tibia, the metatarsal neck, and the sesamoid bone. Hope I've given an overview of repetitive injuries that can occur with sports, but the simplest trick is to use an orthotic and decrease the stresses on these bones and there is evidence to support that.
Thank you, Dr. George. And these images are very helpful. I think seeing it from like a bird's eye view, everyone can just imagine what it looks like on them and their feet, and maybe they can relate to the pain. And we actually have some questions here from our viewers that they submitted for you, Dr. George. They have athletic lifestyles. So we have the questions. And the first one is from Anna B. She says, "Hi, Dr. George. I started running outside about 6 months ago and have been getting a stabbing pain in my arch when I get out of bed in the morning. Could this pain be related to running?"
Thank you, Anna. Thank you for that question. That's a very poignant question. Now, quite likely by what you're describing, it is possible that you have plantar fasciitis. As I said earlier on, plantar fasciitis is pain in the first thing in the morning when you get out of bed and you place your heel on the floor. It feels as if someone is stabbing your heel, and that is the typical pain that is experienced by someone who suffers from plantar fasciitis. And it is possible that the running has caused it because the running has caused a repetitive injury. Now, the repetitive movement of your foot up and down is maybe causing the plantar fasciitis. So you want to dampen that movement where the arch is lengthened and shortened. And to dampen the movement, all you have to do is to cradle the foot on an orthotic. And once you cradle the foot, it is not, there is this repetitive injury is decreased, and that is what our research is also showing. So you could consider buying one of our orthotics. I'm sure Tatiana will show you later on, but you may want to get one with a medial posting or one which the number goes 420, and that will help you with your plantar fasciitis. But if there's more, the pain occurs more, then you need to seek the help of your doctor. Thank you, Anna.
Thank you, Dr. George, for that answer. The next question is from Don B. He says, "I play golf, and toward the end of my round and after completing my round, my feet are very sore, especially under the ball of my feet, and heel area. What can I do to lessen the discomfort?"
It's good that you brought about golf. Thank you, Don B, for bringing about this question. It's good that you brought about golf because golf involves striking the ball with aim and at a great force. Now, though it is a non-contact sport, the amount of energy transferred is significant. So transfer that amount of energy onto the ball for it to travel. We need firm footing. We need the arms need to swing so well with the club that it hits it at the right angle and it pushes forward. So every little helps in this situation. Now, as soon as you wear an orthotic, you're increasing the proprioception. What is proprioception? We all have different forms of sensation. There is a touch sensation, there is a taste sensation, there is a smell sensation. But the another type of sensation is the proprioception, which is not of common knowledge, but very common among doctors. Proprioception is joint position sense. That is, my hand is clenched. I don't need to look at it to know my hand is clenched. As soon as the hand is clenched, the ligaments here send a message to my brain and tell my hand is now clenched. And that proprioception helps us in walking, in taking a golf shot, etc. Because as you walk, as one foot is placed in the ground, there are millions of impulses that tell the brain how that foot was placed. And that will allow the brain to control and make the next step more intelligent step. So the feedback from the one foot helps the next foot, and again the feedback from that foot helps the first foot. Same way, when you're playing golf, because you're having the swing, you need to get the power from the feet, and proprioception from the feet to the brain is important. So greater contour area is important. Now I understand you're having pain. So if you're having pain in the heel area, you need one of the orthotics with either a cup heel or with a medial posting. And if you have pain in the ball of the foot, then you need one with a metatarsal pad. You may have both metatarsalgia and plantar fasciitis. So one of the options which has 2-5 in the end, and I'm sure Tatiana will show us one of those orthotics later on. But if the pain doesn't improve with orthotics, I suggest that you should meet a qualified health professional.
Thank you, Dr. George, and thank you, Don B, for that great question. The next one is from Wendy R. She says, my heel hurts towards the side while I play pickleball, and I am moving around more than usual. What can it be, and how do I treat it?
Thank you, Wendy. Thank you for, again, a wonderful question. Now, whatever game you're playing, you need good equipment, and the good equipment involves having a proper shoe which is accommodating for your particular type of sport. And in addition to every shoe, you want not just a flat surface inside the shoe, you want a contoured orthotic inside, and that together forms the ideal equipment for making any to participate in any sport. And pickleball involves a lot of cutting and turning, and hence, because there is a lot of cutting and turning, you need that contour surface. So it is possible that the simplest way to make you better is to wear an orthotic and see whether that changes the situation. More likely it will change the situation. If not, then you may need to seek help from a doctor. Thank you, Wendy, for that very good question.
Thank you, Dr. George. And our last question is from Rich A. He says, my son is going to start running track in high school, and I want to make sure he stays safe and avoids any kind of injury. Is there a certain feature I should look for while shopping?
Again, a great question, Rich. Now, yes, you need to ensure that you have the proper equipment, and shopping, when you shop, you need to realize you want the ideal shoe and also an orthotic for your child. But more importantly, and I think we should not miss this, it is the ability of the child and the stretching and the exercises that the child needs to do. It is important. Whether you're playing football, whether you're playing golf, you need that strength and that agility. So the stretching and exercising before the sport is vital. Now, I give this example to my patients who come after suddenly having a round of golf without exercising, or jumping and doing a five-a-side football. Now, it's very simple. A soldier is a man with a gun. But that doesn't mean if I give a gun to a man, he becomes a soldier. He needs some training. So same way, even we are all not genetically programmed to go and play football or soccer. We need some training. Our muscles need to be strong. If our muscles are not strong, we are going to injure ourselves. Even kids in school nowadays, it is very important that they are actually doing the exercises and strengthening before they are doing any sporting event. So that is important. Plus the right equipment is important. Thank you, Rich.
Thank you, Dr. George. So yeah, Rich A, if the best way to go about it is making sure that your son is keeping up with all the exercises, the stretching, that they do during practice, making sure you have supportive footwear so they can just build up to the strain that they're going to have on their body. So practice makes perfect. And we also have a foot scanner here that we wanted to share with everyone and explain the benefits of an Aetrex foot scanner. So I'm going to go scan my feet, and I'll see you guys at the scanner.
Thank you.
Okay, so right here you can see there are 4 cameras, and these are 3D cameras. And down here is a pressure sensor that has over 5,000 sensors that is going to help obtain the pressure of my feet. So the way it works is you want to step on the scanner, and you want to make sure your pants are rolled up. You can wear socks, you can be barefoot. And everyone at home, these scanners are all over the world. You can find the location near you using our store locator. So I'm going to start the scan. And if I press start, the scanner is now capturing my length, my width, my instep height, arch height. And this is obtaining the pressure under my feet, and it'll recommend the best orthotics for me. This is the Albert 2 Pro scanner, and this is a really great feature. You guys can get your foot scanned. It doesn't cost anything. And right here, you can see this is a scan of my specific feet. And you can also email the scan to yourself as well. Right here, I'm going to say no thank you for now. So as you can see here, this redness means that I have a lot of pressure in my ball of foot and heel areas. I have a little bit less pressure here on my left foot, but all the other areas are very, very, very red. You can see how red right here. So, and on the left, you can see my foot profile. So it's explaining my arch type, length, width, instep, arch height, girth, and median shoe size. So guys at home, this is so important to know. You know, there's no other place you can get this kind of foot information from than with Aetrex. So if you go and get your foot scanned, you can find all this information out. And if you click here under orthotics, based on my specific foot scan, it is recommending the best orthotics for me. So here it's saying that the premium memory from orthotics will be very helpful for me. And as you look on the pressure map, you can see this is what my feet look like without orthotics. But if I were to put on the memory foam orthotics, my pressure scan would be shown right here in the bottom. You can see that the orthotics are helping to offset pressure, and they're helping to relieve my plantar fascia from stretching. It's really important. And then on the 3D measurements, the camera was capturing a 3D picture of my feet. So based on the 3D image, it'll recommend product that's best suited for me and my specific foot type. This is kind of an example of me looking down at my feet. And a great thing about these orthotics too is if you do have a bunion or a bunionette, it'll kind of show in the area if it's coming in. So it's very useful to have this. And based on where you get your foot scans, you can also see the best footwear recommended for you. Yeah, guys, this is a really great way to know more about your feet. And I'm going to show you guys the product now. So I'm going to head on over. Hi guys, so that was my foot scan, and you can definitely find a location near you. You should definitely do it. It takes just a couple seconds. You learn all this information about your feet. And with that, you can see our orthotics and you can see the best shoes for you. So the first style I want to show you is our Compete Orthotics. I have a pair right here. So these are our Compete Orthotics. There you go. They have arch support built in. And these orthotics are great for those who have an active lifestyle. If you want some extra support in your everyday shoes, they are $64.95. And here's an example of a person going on a walk with them. This is really great orthotic, and these are designed to help you stay injury-free and maintain your overall health. They're great for walking shoes, boots, golf shoes, tennis shoes. They have a Copper Guard antimicrobial top cover. They have a ProShocks polyurethane center that helps absorb shock and reduce impact. And they also have a performance base of aerosol polyurethane for high energy return. They come in women's sizes 4 through 13 and men's sizes 6 through 16. And these are great for golf, for tennis. If you guys know Lexi Thompson, she is a professional golfer, Olympic golfer. She loves to compete. She wears them in her shoes on and off the course. And this is how our orthotics work. So a lot of shoes come with a removable insole, and you just take it out. And as you can see, this insole is just not supportive. It's very flimsy. It's not firm, it's flimsy. So this cannot support your feet. And if you compare it to an Aetrex orthotic, you can see the difference. So the Aetrex orthotics have arch support. They are firm but flexible. And how they work is I already took out the insole, and you just slip them in. And that is how simple it is to wear an Aetrex orthotic. You just remove the insole from your shoe and you insert the Aetrex orthotics. And our orthotics, they also do not come in half sizes. They come in full sizes only. So if you are a half size, we recommend sizing down This will give you a little bit more space in your shoe, and you will have to go a size down. So for example, if you're 7.5, you're going to want to get a size 7. And these are the Compete. And the next orthotic we want to show is our Speed orthotic. These are the Speed. They are $64.95, and these are designed, for runners who want to enhance their competitive edge. These help prevent injury. They help alleviate discomfort and fatigue while running. They come in women's sizes 5 through 12 and men's sizes 7 through 16. And these also have the polyurethane base for high energy return. They have a mesh fabric top cover, and here's a runner with them. You can see she's inserting them into her shoes and going out for a run. They are $64.95. So they have the antimicrobial top cover, and they have an exofoam layer for super lightweight cushioning and support. And these are great for runners. They're good for your athletic shoes, tennis shoes. And the next style we have is our Cleat Orthotics. These are the cleats. They are unisex, $49.95. They have arch support built in right here, and they are designed specifically to perform in shoes and athletic styles and cleats. They're great for if you play football or baseball, soccer. They have a mesh top cover, and they have a polyurethane base for high energy return, and they are $49.95, and they come in sizes 4 for men through 5. Sorry, size men's 4, which is a women's 5, and also through men's size 14, that is a women's size 15, because they are unisex. And they work the same way. You just remove the insole from your shoes and insert your Aetrex orthotics, and they have arch support built in. So arch support is found in all Aetrex shoes and orthotics. And for shoes, it's either built into the footbed or with a removable insole that we will show you very soon. And our orthotics also come in an option if you want to get a posted heel, if you had a plantar fasciitis or overpronate. We also have a metatarsal pad as well as an option. And now going into the product, this is the Emery sneaker. They are $129.95, and they have arch support built in with a removable insole here. And it has the arch support. It also has our Cobra orthotic technology that's designed to cradle your heel. And the extra cushioning here helps relieve forefoot pressure. So this has a microfiber top cover and an Ultra Sky EVA bottom for shock absorption. And they come inside the Emery sneakers. And the reason also why it's made with a removable insole, let's say you really like the Compete and you wear them in all your shoes, you can definitely use these inside your Aetrex shoes. That is a great accommodating feature, that the removable insole. They also have a pull tab for easy on and off. They have adjustable laces to help you get the perfect fit. They're made with this stretchy mesh material that's very comfortable. They have a padded heel, and they also have rubber pods here for durability. And they come in women's sizes 5 through 5.5 through size 11. This is the Emery. And the next style we have is the Danika Sneakers. So all these shoes that we're showing you guys are really great for, walking, lightweight activity, medium activity. Danika is $139.95, and just like the Emery, they have arch support built into the removable insole, and they also have our Cobra orthotic technology built in. They come in lots of colors, so do the Emery, so check out aetrex.com. They also have adjustable laces, a pull tab for easy on and off, padded heel, collar, and tongue. And they also have this really cool rubber outsole here that has a recessed heel that helps provide comfort and support. They're $139.95. And our last style, it's not not necessarily an athletic style, but this is our Maui orthotic flips. They are $59.95 and they come in men's and in women's in several different colors. This is one of our newest colors that we just launched. And the reason we're showing these and why we love these is that they're orthotic flips. They're very supportive, comfortable, lightweight. They are made out of Ultra Sky EVA foam. They're water friendly. They even float in the water. And after a workout or after, let's say, a soccer game, you can take off your shoes, get out of those sneakers, those cleats, and just put on a pair of flips, just for that comfort. They are so comfortable. They look great on. You can really dress these up or dress them down. You can wear them with leggings, like leaving the gym. You can even wear them with the dress here. They are $59.95. They have arch support built into the footbed. They have our Cobra orthotic technology built in. They have a soft toe post, which is very comfortable. And they have this dual density outsole here that helps relieve pressure from the ball of foot and heel areas. And Dr. George, do you want to just tell everyone at home the importance of arch support?
Now, Tatiana said that this is not a sports supporting footwear, but actually, I feel it is very useful in sports, not when you directly wear it, but in plantar fasciitis, as we visited plantar fasciitis, that is one of our research projects that we are doing, because orthotics can give you support as long as you're wearing a shoe. But what do you do when you get out of bed first thing in the morning? You don't have a shoe, you don't have an orthotic. So the best thing to wear is a Maui flip, as what Tatiana is showing now. So when you get out of the bed, put your feet into these flips. It supports you. So the walk to the bathroom is not walk on spikes or not on pins and needles. It's more comfortable. So though it helps you by decreasing the pain from plantar fasciitis, it helps you to do your sporting activity, which gives you great pleasure. So this is indirectly a sporting equipment which will help to maintain your sporting activity.
Thank you, Dr. George. Yeah, guys, and Maui.
And one thing about scans, we are all many of my patients say, why do we need a scan? But a scan is very important. Look at our car tire. When 40 years ago, when we changed our car tires, you just went and changed the car tire. But now, before you change our car tire, you align it, you balance it. Your car tires get better treatment than what your feet get. Your feet, you may be 30 or 40, you have never scanned your feet. Whereas your car tires every time. That is because we have spent a few $50 or $60 on our car tire, and we think that our feet are free of cost. But the feet require attention. You get only one pair. So the scanning the feet, it helps to get the alignment straight, and then the contoured surface inside. And the contoured surface inside is, as I said earlier, recreating nature inside the foot, so that you are cutting off a piece from the beach and keeping it inside your foot and taking it around. That is the comfort that you're getting.
Thank you, Dr. George. And that's a great point, too. You're taking nature and you're putting it into your shoes. Guys, today's Earth Day. Come on, correlation, orthotics and Earth Day. So definitely check out Aetrex.com, get your foot scanned. We're also offering free shipping all month long. So if you've been eyeing a pair of shoes or orthotics, now's your chance to get them. We want to recommend signing up for our loyalty program. The more you spend, the more points you get, and the more you save. And also sign up for our emails and text messages to be the first to know about new products, exclusive sales, and fun events like this live. Dr. George, thank you so much for all this medical information. We appreciate you coming and being here with us every single week. And next week will be our last live for Foot Health Awareness Month, but I'm sure we'll be doing these way more in the future. So thank you, Dr.
Thank you, Tatiana. You conducted it so well, as always. Thank you very much.
Thank you, Dr. George. And you were amazing as usual, too. And everyone at home, thank you so much for joining us. And if you are experiencing foot pain, make sure you go see a doctor and get a full diagnosis. Thank you, guys. Have a great weekend, and we'll see you next week.
Thank you. Bye.
Bye, Dr. George.